Health Coach Training Part 2, How Coaches Can Fill a Vital Need. You've learned about how coaches and the personal health record are an effective combination for helping patients with chronic disease, with adopting healthy behaviors, and with staying out of the hospital after hospital discharge. In this lesson, we're going to focus more on exactly how it is that health coaches have been shown to be effective in helping patients develop healthier behaviors and choose healthier lifestyles. You're going to hear from Dr. Werner.
In our country, about 20 to 24% of patients smoke, about 60% don't maintain a healthy weight, 77% don't consume 5 or more fruits and vegetables in a day, and 78% don't get regular physical activity. So if you take all these things together, all these lifestyle characteristics that are modifiable, there are only about 3% of the U.S. population that does all these things, all these 4 things, on a regular basis. So that means on average about 97% of patients need to change at least one behavior, oftentimes more than one behavior, in order to either restore their health or maintain their health. If these 4 factors, all of which are modifiable, all of which are things that patients can do something about, if these could be eliminated, at least 80% of all heart disease, stroke, type 2 diabetes would be eliminated, prevented, and 40% of cancer would be prevented. Our clinicians, primary care clinicians in particular, have a lot of time pressure due to economic pressures and financial pressures on healthcare systems. So this time pressure and the need to move on to the next visit quickly oftentimes creates a situation where clinicians are more likely to want to tell patients about what to do than ask patients for their own preferences and really try to understand and work through with patients what will specifically work for them. Why is it that advice doesn't work? Well, there are 2 main reasons why advice doesn't work. And that is that clinicians, because they're in a hurry and don't have a great deal of time to discuss these things, are oftentimes not well understood by patients. So patients may not really understand the details about what the clinician is asking them to do, or all the depth around the health problem and how it is impacted by the lifestyle or by the medication use or whatever it is that the clinician is asking them to do or telling them to do. So the lack of understanding is a big barrier to patients being able to implement whatever clinicians are telling them to do. The other primary aspect of this sort of non-compliance, non-adherence, is that the patients aren't asked their opinion about how they feel about what the clinician is telling them, if the clinician is simply telling them what to do and not involving them in that decision-making process. They're not asked their opinion, so they don't really have investment in this behavior that the clinician is asking them to do. And sometimes patients simply don't agree with what the clinician is asking them to do because it doesn't fit in the context of their own life. The clinician doesn't have any way to know that because they haven't asked the patient about whether this would work for them, and if not, what would work for them. So what happens is it results in a lot of wasted time, actually. So even though time is scarce, what time is given to helping patients manage their own behavior can actually be wasted because there's poor communication between the clinician and the patient. And that leads to wasted visits, repeat visits where things that were discussed in previous visits haven't been addressed by the patient or haven't been done. Frustration on the part of the clinician, frustration and futility, feeling of futility on the part of the patient. So something really needs to be done about this. So this is really where health coaches come in. Health coaches really come in to work with patients and help patients understand the clinician's advice, discuss with the patient how they feel about that advice, and work with patients around other ways to improve their health, priorities that the patient may have to improve their own health. So the health coach provides more time for the patient to work through how they're managing their health problem, how they can more effectively manage their health problem, and how they can do that effectively within the context of their own life. So the health coach really regards the patient as the expert on his or her own life, which they truly are. So we're there as health coaches to really facilitate the patient being able to make decisions and implement those choices and decisions in their own life in very realistic ways.
In summary, you've heard how common unhealthy behaviors are. You've seen why it's a challenge for doctors to help patients change unhealthy behaviors. And hopefully you understand now the vital role that health coaches can play in helping patients find ways of changing their behaviors that fit in the context of their lives. Thank you.